Clinical psychology is an integration of science, theory, and clinical knowledge. How can addiction facilities benefit from having a clinical psychologist as part of their senior management leadership team? I'm your host, Suzanne, and this is Recovery Matters. Back with my guest today, Dr. Tina Goodin. Nice to be here with you again, Dr. Goodin. So we left off at, let's describe for our viewers, what is a clinical psychologist?
A clinical psychologist, as compared to an experimental psychologist, a research psychologist, a child psychologist, is the person who does psychotherapy face-to-face with the patient based on issues that arise in their lives that they want to resolve, that could come under the heading of a personality disorder or a situational reaction. And so clinical is anything that happens in a hospital or in a clinic or in a private practice about the life of the patient.
Okay. So I know one of your areas of passion is the addiction field. Mm-hmm. Particularly, we have a really certain culture of addiction field here in the Florida model versus what may be happening in other segments of the country. But in this segment of the country, we have licensed clinical social workers, we have master's level clinicians, we have peer-to-peer counseling, we have clinical psychologists. How would you differentiate the need or each of those roles in a treatment facility?
That's an excellent question, Suzanne. So typically there's a primary therapist at a chemical or addiction treatment facility, and the primary therapist is typically, especially in the Florida model, but others as well, nationwide, a master's level clinician. Masters of Science, Masters of Arts, Masters in Counseling and Psychology, but they're master's level people. And they may have done a training, a psychotherapy training, after their master's degree. So when they come to the facility, they are equipped to do a psychosocial assessment. They're equipped to do cognitive behavioral therapy. They're equipped to probably run groups. Mm-hmm. They're equipped to do some of the case management. When you have a clinical psychologist on board, a clinical psychologist typically goes well beyond a psychosocial assessment. Typically, a clinical psychologist has been trained to do a psychiatric assessment. And that includes many other parts of what we need to evaluate, such as spheres of orientation to time and place, and any thought disorders, any cognitive deficits. And so other master's level people are not trained to do that. To some extent, more importantly, they're also not trained to do the deep work. And in treatment centers, even if it's for 30 days, that treatment, we can begin to uncover and use the 30 days as a launching pad to titillate the curiosity of our patients so that they are interested in knowing what has contributed to their symptom, the addiction, so that they can get to the other side and turn it into action and resolve it.
So that they can engage more in the treatment process. And we know that
Yes.
treatment longer is treatment better for those who have a great chance of success.
Yes, yes. Okay. Treatment longer and better treatment.
That's right. So how does a clinical psychologist impact an administrative leadership team? How can they best be utilized? How can their skills serve the bigger picture?
So what we typically see is the psychologist that has his or her focus on the patient, offering services to the patient. However, there are so many talented psychologists out there who have been administrative leaders and have created programs and have made a facility soar. And yet, at the same time, they are often not in those roles that are administrative. And so we have a position called a clinical chief clinical officer, for example. Mm-hmm. And that sort of sits on the fence between the clinical and administration. But then when we move into chief operations officer and CEO and executive director, oftentimes psychologists are really adept and talented and have tremendous experience running a facility and need to be given the opportunity to do that because they do it, they can wear both hats. They bring golden talent that can bring together the bottom line, which is what the business side is about, together with clinical excellence, which is what the business is saying they want to offer in order to help their bottom line and to help people. And so the clinician who is adept at doing both and really talented at that is exactly who you want to make that happen.
So I would think, as you say, that that would be a valuable skill and expertise to any facility that is engaged in doing good business and a facility that is looking out for the best interest of the client. What are some of the barriers that maybe you found or that prevent facilities from having that sort of executive leadership from a clinical psychologist?
Well, partly it's because that's what they've done to date. So there's a certain resistance to change, which happens, it's part of the human condition. So when something new comes along, they're a little bit reticent. On the other hand, there's perhaps this idea that someone with that kind of expertise is actually really overqualified on the clinical side, and so they don't know what to do with that, in the sense that it can almost feel as if, well, geez, are we going to be figured out here as administrators? I don't know. Or is that person going to be able to actually really deal with what goes to make a bottom line a great bottom line? I can't believe it. Show me the goods, as what's her name says, Susie Orman said. Show me, you know. And so then the difficulty can arise where whatever is shown isn't quite good enough. It's not enough, because there could be a little bias there. And I want to encourage administrators out there to be able to take off that hat and say, hey, we have talent before us. Wow, look what we've got. We have a person who's able to do both. And are we going to soar because of that? She's done it before, she'll do it again.
Right. So it sounds like you have a lot of ideas through your years of expertise, a lot of thoughts, a lot of experience to have a plan or some ideas of action that could benefit probably facilities all over the country.
All over the country.
So I think when we come back, I'd love to hear some of your thoughts or vision for change with regard to the addiction field and the patients that we are made an ethical agreement to serve. So I think I'd love to talk about that and hear more about that.
Great, thank you.